hip flexor release and extension, pails and rails contraction. This stretch targets the deep hip muscle, the psoas. This will be commenced by tilting your pelvis frontwards. Ensure your butt is not sticking out because this will not adequately isolate the targeted muscle. Ensure that the end range is only from the hip and not compensated from elsewhere in the body. Typically, a hip will have about 10 degrees of extension. This position may be altered by turning your torso in order to ensure the stretch is felt in the psoas. This can be aided by even holding the same side arm up and having a slight side bend, or having your legs slightly rotated inwards or outwards. In order to do this stretch properly, it is important to ensure you are feeling the stretch in your psoas and not within other parts of your hip. You will sit in the end range position for 2 minutes and then slowly build up the tension throughout your body. This can be assisted by clenching the hands or even having a dowel. The pails contraction will be to push the knee down into the floor. You should be feeling tension within the front of your hip joint, holding this for 10 seconds. The rails contraction is done by contracting the glute muscle and sinking slightly lower into the hip extension, holding actively for 10 seconds. These contractions should be ramped up over a period of 5 seconds each. These contractions are then followed by a 2-minute period of passive end range stretching. This cycle can then be repeated with both legs. While doing these stretches, ensure that no pain persists when in the passive end range of motion, or if pain is too great when contracting, stop the exercise and ask a therapist if this stretch is right for you. Any questions about angular isometric stretching should be directed towards a therapist or professional within this field.